Using robots for telemedicine reduces the risk to healthcare workers. We are interested in the task of heart and lung auscultation, which is an important physical examination that is performed regularly. Previously, remote heart and lung auscultation has only been achieved via teleoperation, a video of which is shown here. However, teleoperation is mentally and physically taxing. In this work, we demonstrate the first system that automates this task. In particular, our work seeks to locate sounds of high diagnostic value instead of directly making diagnosis. Here, we give an overview of our method. The system consists of two phases. In the offline phase, we obtain a data set of stethoscope recordings from a human and ask experts to rate them. Then, we train a sound quality estimator with this data set. During an online auscultation session, the robot first takes a point cloud of the human and performs non-rigid registration onto a reference model with labeled clinical auscultation locations that the robot will listen to. Then, we generate a prior sound quality map based on the registration. This map is parametric, consisting of a fixed reference map and parameters of sound quality scaling and translation. We infer these parameters online given new measurements. The green circles represent the search region at each of the clinical auscultation locations. To determine the optimal sensing location, we use base-opt, short for Bayesian optimization, where the unknown sound quality field is estimated as a semi-parametric residual Gaussian process model. The residual GP models the residual between the observations and the prior quality map. This is done separately for the heart and lung sounds. BO then sends the optimal sensing locations to the robot to perform auscultation. The sound quality is estimated with the learned estimator. BO returns the best sound in each region after the estimated sound quality is above a threshold or when the auscultation budget is used up. Next, we demonstrate heart auscultation in one region. The first attempt gives an estimated sound quality of 0.15, which is poor due to registration uncertainty. The second attempt is still unsatisfactory. The third attempt gives a quality of 0.54, which is above 0.5, a threshold we consult experts to set for satisfactory quality. The robot then moves on to the next region to auscultate. We compare our method against two baselines. One is registration only, when we auscultate only based on visual registration. The other is direct teleoperation by a medical expert. We first give a qualitative comparison of the three methods by showing the best sound found in the heart region that we just demonstrated, and we will play the recorded stethoscope recordings. The heart sound can be clearly heard. We can only hear weak heart sounds. Here, the heart sounds are obfuscated by breathing sounds. We compare the three methods across 4 human subjects at a total of 12 clinical auscultation locations. We found out that Bayesian optimization achieves similar quality and operation time as direct teleoperation. In addition, Bayesian optimization improves quality over registration only, demonstrating that Bayesian optimization can overcome registration uncertainty.